Hello, hello. My name is Jess, and this is Patient POV. And today we're going to do things a little bit differently than normal. I usually give an update on myself, whether it was how was the week or what I've been up to. But today we're going to hear from Lindsay. And so Lindsay is the guest of this episode. But when we actually recorded back in February. And I can't believe it's been a few months. But as I texted her about the release of this podcast episode, she was like, well, actually, this is kind of interesting because a lot has changed in her life. And so we are actually going to hear from her about how she has been doing and how the gap between February to I'm releasing this end of May. So we recorded beginning of February to the end of May, how just a few months has made a big difference in her life. So we're going to hear from her in just a second. I really wanted to do that because I thought it would be a good way to see how chronic illnesses are dynamic and they're forever changing day to day. And so, according to creakyjoints.org, which is a nonprofit organization for rheumatoid arthritis, I really liked their definition of it. A dynamic disability refers to a condition or impairment that varies in severity and impact over time. So, it's always changing. Unlike a static disability such as amputation or paralysis, which remains constant, a dynamic disability may have periods of remission or exacerbation. So that kind of gives us a little intro on dynamic disabilities and kind of the realistic view of it. And so thank you, Lindsay, for joining me now to share how you've been doing, and we'll hear you'll be able to share how you're doing now, and then we'll hear about how you were doing back in February, just after this intro here.
Yeah. So essentially when we originally filmed the podcast, I was working part-time as a high school teacher. And while it was taxing energy wise, I was doing really well, keeping up with teaching, and was even able to do things like hour-long things even after a part-time day at work, like recording the podcast.
Mhm.
And then unfortunately in mid-March, there was just kind of like a perfect storm of situations and things that caused my body to go into a crash. And I thought it was going to be like a couple of days or a couple of weeks. And unfortunately, it's turned into like a couple months long MECFS crash,
Mm.
which for a while I was essentially bedbound. Now I'm more housebound. And I'm like building towards being able to like have very, very short periods of time outside the house. Um, but just my energy levels have significantly changed since then.
Hmm. And so when you talked to me in February, I do
Mhm.
believe you were mentioning that you had suspected um, a chronic fatigue syndrome and mast cell activation syndrome, I believe. Did you
Mhm.
ever get a diagnosis for those? I mean, you're mentioning the chronic fatigue
Yeah.
crash, but
I still haven't gotten a official diagnosis for MCAS, but I did get diagnosed with MECFS officially in March, when I had my huge crash. And so, I guess in some ways it's nice to have the diagnosis, and an explanation for like why I went into this big crash. But it also, was an unfortunate way to get the diagnosis.
for sure, yeah. And so when you're talking about like you've gone from being a part-time worker now to bedbound, now a little bit housebound, getting your strength back, is there anything that you've been using as like motivation to keep going, or like things that you have been doing to tell yourself to like that motivation piece? Anything you can share there?
Um, I mean, I think it's been like ME/CFS is a beast in that it's like one of the few conditions that you can have that like overexerting yourself can lead to further deterioration.
Mm,
So it's hard in terms of like having particular like physical or exertional motivations to kind of keep me going because I was really wanting to make sure that I really actively rest as much as possible. But I feel like the marker for like what became kind of like big milestones were changed. So for example, like it became like really big when I was able to tolerate light again.
mm,
Because for a while we had to have like blankets up, like covering our blinds so that it was just like pitch black in the room. And it was like really, really big one day to be able to like take those down. And we have like a window seat by our bedroom window and like being able to pull up the blinds and like sit there for 10 minutes and just like take in the view of the hills. And that was like really big. And I think also just kind of like building to things like being able to go downstairs once a day. We have like a really beautiful garden, like being able to like first start from like sitting in the house, like
mhm.
looking at the garden, and then building to like being able to tolerate light and like have some sunlight exposure in the garden. And so I think it's just kind of getting back some of those things that just are really meaningful. I think having like the energy and capacity to be able to communicate more with my loved ones, to be able to have like an occasional meal with them has been really nice. So those sorts of things have been helping to keep me going.
That's amazing. Yeah. So, um, would you say like that setting of like realistic and obtainable goals that are much more reduced than maybe what you had before? I really like that. That's that mindset switch kind of having to happen, and then the communication with your loved ones is really great.
Yeah,
Yeah.
I would definitely say like yeah, shifting to those more realistic goals, and just kind of um that experience of coming to like a radical acceptance of like what my
Mm.
shift in baseline is.
Yeah. Radical acceptance for sure. Yeah. Yeah. That's
Hmm.
always hard.
Yeah.
Okay, wonderful. Well, thank you so much for giving us a little bit of an update on kind of where you are. As I mentioned before, I thought it would be a good way to kind of truly see like an example of a dynamic disability and how it changes within a few months. And so we'll hear about you from February and kind of an update now, and hopefully you'll just keep improving and going up, and everyone can follow you along on Instagram. Can you remind us of your Instagram account?
Yeah, it's that spoonful of Lindsay.
Wonderful. Yeah. So everyone can find you there and keep up with your updates there as well.
Yeah, thanks so
Wonderful.
much, Jess.
Thank you. We'll hear from you soon. And before we jump right into the conversation we had in February, don't forget to like and subscribe, leave a review, and I'll leave a question in the um, I'll leave a question out there so that you can either answer on Spotify, or if you're listening on YouTube, you can answer in the comments. And yeah, you can also head over to patientpov.ca and you can check out more information on the podcast episodes. You can get some you can look at the blog, you can get some freebies, product recommendations, all that good stuff. Head over to patientpov.ca. And thank you guys all for support as always. And I hope you have a great week ahead. Hello, hello. How are you today?
I'm good, thank you. How are you?
I'm doing well, thank you. Do you want to just start by giving a little introduction on who you are and kind of your health journey background?
Sure. So my name is Lindsay, and I have been part of the chronic illness community since I was about 20. And I first started my journey with migraine disease. I started getting migraine attacks when I was a sophomore in college. And it was really a struggle for about a whole year until I really found like a diagnosis and a neurologist and kind of like figuring out medications and things to get it under control. And kind of my journey has been up and down. I have had periods where my migraines have been more in remission. And then when I was about to turn 30, they came back with a vengeance and kind of changed and became vestibular migraine, which means that it presented a lot as vertigo. Um, and so that really was disruptive to my career and having to take time off. And then in the last couple of years, I have been diagnosed with a lot of conditions, including small fiber neuropathy, POTS, long COVID, vocal cord dysfunction, and suspected MCAS and also MECFS. And some of it was triggered by like I had a really rare neurological reaction to the booster vaccine.
Mm.
And then some of it like was then triggered when I got a COVID infection like a year later. And so I've just kind of been juggling a lot of that. And during that journey was when I started an Instagram page to kind of share about my life and what I had been going through.
Amazing, yeah. And so we've had a few people chat about POTS in particular and long COVID,
Mhm.
and then you were selling was it mast cell activation syndrome was what you
Mhm.
were mentioning there, and then chronic fatigue syndrome was the ME CFS.
Mhm.
And so we've
Mhm.
had a little bit of an explanation on what some of those are for anybody who's listening. So I'm wondering if you would be able to touch on what small fiber neuropathy, what it is, and kind of how it impacts your life.
Yeah, of course. So essentially, small fiber neuropathy is like when you're dealing with like a lot of pain, like with your nerves, like your nerves are almost like hypersensitive. You can deal with a lot of like electric shock kind of like pains. It can also present as numbness, like tingling, and mine is mostly like centered on the left side of my body, where like my left arm will go numb, or I'll lose feeling in my feet and it'll kind of like creep up to my kneecaps. So I don't feel as like stable when I'm dealing with a flare up of my neuropathy. But also it's affected things like unfortunately I'm left-handed, and so it's really difficult when it's flaring for me to be able to write. And I'm a teacher, and so it can be hard, like to type or handwrite. And so I just kind of have to be like immobile when it's really bad.
Yeah, fair enough. And please note, you are totally free to talk about any of the conditions that you struggle with. And when we're answering the questions, it's nothing about, well, we've already talked about that condition. No, it's just I try to do a little bit of education whenever we have a new condition that we're talking about, or whenever it's introduced. So I was like an educational piece inside things as well. But now, speaking about you and anything about you, what are
Mhm.
some of the challenges that you face on a daily basis that are like impacting your life the most at this point?
Yeah, I would say um so in terms of like with my conditions and how they are impacting my daily life, is that the question?
Yeah, yeah.
Yeah. So I would say the big thing has been I've been dealing with a great deal of brain fog, which has been really hard. I teach high school English, and so it can be very hard, especially with a very cognitively demanding job. Like as a teacher, you're making so many micro decisions a day. But then also in terms of the content that I teach, I'm teaching my students about literary analysis or I'm trying to grade essays. And it can be really hard when my body reaches that level of cognitive fatigue that I have a drop off, and it's really hard for me to sometimes recall words, and it can be really hard for me to grade papers. Like I don't move at the pace that I used to. And so I've just kind of had to learn to adapt things. I was out of work for almost 2 years. I had to take a medical leave of absence, and I transitioned back this August, part-time. And I essentially had to request to only teach one type of class so that my brain wasn't split in too many different directions. But it's still been a lot for my body. And then I think, also just the like intense, like bone deep fatigue that I feel at the end of the day. Like I pretty much get home from work, I eat something, and then I normally, if I don't have an appointment, I nap for like 2 hours at least. And I think the other thing that's been challenging is not always having people who at work understand like what it is that I go through on a daily basis. Um, like I do think that I have some colleagues that are really um good at like educating themselves. But I have others that I think, have made comments to me about like, oh, it must be so nice to work a half a day. And knowing that, my half a day is like I feel more exhausted working my half day than I did like when I was working full time and like going to grad school full time. It's like a different like level of fatigue and exhaustion.
Yeah, for sure. And so, for everyone who's listening, just as a little bit of context here, we are also recording at the end of a school day, shall we say. And so, I do appreciate you
Hmm.
taking the time, even though you are, I could assume, pretty exhausted. So, I do appreciate the time, of course. Um,
Thank
so,
you.
so then, um, jumping into those, you've explained a few of the challenges. Have you found any coping strategies? I know you said you're doing like only half day and then the same subject, which are great accommodations for at work. In terms of any of the other symptoms or those symptoms, have you found any good coping strategies?
Yeah. I would say like one of the biggest, I don't know if it's necessarily like a coping strategy, but I think one of the biggest things that has helped me has just been really advocating fiercely for myself. I am very, very fortunate to have a really supportive medical team around me. My primary care doctor and my neurologist are really supportive. But I am just very like explicit and honest with them, like how hard things actually are. And then we brainstorm together like ways that I can make things easier. Um, and I, have like certain accommodations throughout the day. Like I use a mobility aid to like go into work. And then we have security on campus and they like drive me from my classroom to the parking lot, so that I'm not overexerting myself. And then I also like luckily have like two very supportive colleagues that I'm able to like talk to. We have planning periods together. And so we problem solve things. And we just kind of like think of ways for me to kind of like creatively do things if I don't have the energy to do them in the way that I used to before. And um, I also feel like I, after work, like I do yoga nidra a lot, which is like a deep kind of meditation. And I feel like, especially on days that I'm dealing with feeling like wired and tired simultaneously, like it's this odd feeling where like I know I'm really tired and should rest, but I'm so amped, like adrenaline wise from the day. that's a really great coping mechanism that I found that's kind of like brings my body down to like a state of rest. And then I just let myself sleep.
Yeah.
And yeah, and I think just like giving myself permission to do what I need to do to survive the week.
Yeah, fair enough. And so, the deep breathing exercises, do you follow something in particular, or are you just like deep breathing, or do you follow something? I guess is the question.
Yeah, so there's an app that's called Yoga Nidra, and it's like a guided deep meditation. And I use that, and there's different like menus that you can choose from. So one is like rest and recharge. So if I have a day where, like, unfortunately, I like come home from work and like take a nap and then I need to have a doctor's appointment or I need to have something that evening, which I normally try not to do, but sometimes it happens. I'll do like a rest and recharge one. That way it's like helping my body get like some restoration. But then there's also like a deep sleep one. So if I feel like really, really fatigued, but my body's not letting me go into sleep, like I'll do that before I take a nap. And then normally I like fall asleep in the middle of the meditation and then I wake up when when my body's ready.
That's awesome. Yeah, I might have to check that out as well. That sounds great. And so whereabouts in the world are you located?
I'm in California, in the
California, yeah.
United States. Yeah. Mhm.
Perfect. Okay. I'm from Canada, so that's why I always ask the context of where you're located. So how did you find how was it navigating the medical healthcare system in the States?
Um, it was really hard. I feel like the initial, like, as I shared, I have multiple diagnoses. And so I feel like anytime I had like a new condition that was happening, um, it was really, really hard to navigate the system. And even though I had like health insurance every time, and thankfully was covered, it was really hard to get a specialist. And in particular, when I started, around my 30s, getting vestibular migraine, I was getting like dizzy all the time and I just felt like I couldn't drive, and I had gone to my primary care doctor and had shared, the symptoms that I was experiencing. And when it wasn't resolved with like traditional methods that are used for vertigo, like Dramamine and like doing an Epley maneuver where they like move your head, um, she essentially came to the conclusion that it was in my head. And it took like 6 months of fighting, for me to like advocate to, actually see a specialist and get to neurology. And then once I found a neurologist, like things got a lot better. But I think that that process of like being able to get to a provider that can actually give you answers and believe you, um, is much, much harder than it needs to be. And I feel like I was very fortunate that, um, this time around when I started having like my neuropathy symptoms and pot symptoms and all of these things that were happening, I had since, fired that primary care doctor a long time ago, and gotten a much more affirming one. And I already had a neurologist because of having migraine attacks. And he like believed me right away. I was like, something is wrong. Like, I don't know what's happening to me, but like, I feel like I'm having a stroke. Like, the parts of my body are going numb. Like, I'm really scared. I've gone to the ER like 5 times and like they just keep telling me like something's in your head. And he was like, no, like this is what's happening. And so I feel like the unfortunate thing with the American healthcare system is like how hard it is to get to a specialist and like find one that believes you. And I wish I could say that it's like rare that you find doctors that don't believe you and dismiss you. But it's not. And I just feel really lucky that I have the care team that I do. And I know that that's like something that not everybody gets.
Yeah, for sure. And although you do have a great care team now, you were
Mhm.
mentioning before that you had to advocate for yourself and you had to kind of fight the fight. And so I'm wondering if you have any either advice or strategies that you used in order to be able to advocate for yourself better or more efficiently.
Um, I mean, I feel like when when it first was happening, like I just was in such disbelief that like this doctor would be like, "Oh, it's in your head." Um, that I kind of kept like going back to her and being like, "No, this is real. Like these are all the things that are happening." But I feel like now, like now that I've a more experience like with the healthcare system, like my advice would be to like fire that doctor like right away and like
Mm.
find a new one. And I think like one of the things that I learned by finding my new primary care doctor was that like when you have the choice to be able to pick your primary care doctor, their bios can be really helpful
Mm.
at finding someone that feels like they would be a good fit with you. And my primary care doctor, I was really attracted to her practice because she talked a lot about patient empowerment and like advocacy and like trying to like work together as a team to be able to figure out what was going on. And I felt like all of that language that she was using, I was like, well, like, she could just be saying that and like not be that great.
Right.
But fortunately, she did like believe all the things. And so I feel like, and then once you have like one really solid person in place, like with her, I feel like um whenever I need to like go see another specialist, I normally ask her like, who do you recommend? Like, who do you feel would match best with me? And then she's also been the person that I turn to like when I have gone to see a specialist and they've been really dismissive. And then she'll say like, we're not going back to them again. And she'll like kind of put them on a list of like, I don't send my patients to that person anymore. Um, and so I think, yeah, like if you can, finding a really supportive doctor. And then another thing that I've heard from people is when a doctor refuses to do something, to like actually ask them to record in your notes that they're
Mm.
refusing to test you. Because oftentimes that'll like make them run the test because they don't want it in your notes that they were refusing things.
Yeah, for sure, for sure. Especially in case it ends up being that thing, then they don't want proof that they had malpractice or anything like that. For sure.
Mm-hmm.
Those are really great advice. Now I'm wondering if you have any so I got distracted. Siri turned on at that point too. I was talking and Siri turned on and she was recording everything we were saying. I was like, let's not. Um, I'm wondering if you have any words of I know we were talking specifically about like appointments, but just in a more general sense, do you have any words of encouragement or advice to somebody who is either trying to get diagnosed with something or in the middle of a flare or anything like that? Words of advice or encouragement to them?
Yeah. I mean, I think especially when it comes to like trying to get a diagnosis, I think my like words of encouragement would be um that what you're experiencing is real and valid, and you deserve to get answers. I think for me personally, I know that sometimes when you get dismissed by medical professionals, it's it can like easily turn into like am I making this up? Am I actually feeling the things that I do? And like you are, like they are real, like, and you deserve to like have someone who gives you answers. Um, and and I would also say that, like, as someone who's also living with a few conditions that have been like guessed at, like my doctors think that I have ME/CFS and they think that I have MCAS, but like MCAS is really hard, like notoriously very hard to diagnose. Um, I would also say that just because you don't have a clinical diagnosis, like doesn't make your experiences or your symptoms any less valid. Like you don't have to have a diagnosis in order to like belong to the community or like deserve to be able to talk about your symptoms. Like it doesn't, like you don't need the diagnosis in order to have like the clout or feel like you belong, or like people shouldn't dismiss you because of that.
Yeah, wonderful. And now turning towards that subject of the community and whatnot, how did you, why did you start getting involved in the chronic health community online? And what was your motivation for starting that?
Yeah, so essentially my motivation was I started getting really like I had like a personal Instagram account and I was following a ton of people that were publicly talking about their chronic illnesses. And I was following one individual in particular who like has the handle like pot stabilities, and she shares about like living with POTS syndrome. And she had a video that was like, do you experience these symptoms? And if you do, like, you might have POTS. And like, one of them was like, are you constantly being dismissed with having like anxiety and like it's all in your head and like all these things? And I was like, oh my gosh, like that's me. Like I have all these symptoms. And I keep going to the ER and being like, I think I'm dying and I'm having a heart attack. And they were like, oh, here's some anxiety medicine, like go relax, do some yoga, and like you'll be fine. And I was like, no, like something's wrong. And I saw her account and I then like went and talked to my doctor and I was like, hey, like any chance I might have this? Um, and I ended up getting diagnosed with POTS, like because of someone in the chronic illness community. And the fact that she was like raising awareness for it. And I decided like I would like to do that for someone. Like I would like to be one of the people that's like sharing about my experience, because it's really lonely and it's really confusing when you're trying to figure out what's happening to you.
Mhm.
And like you feel like there's nowhere to turn for answers. And I think one of the most common things is that's really great about the chronic illness community is so many people like end up getting answers or finding out things like through other spoonies because like someone else posted about their experience, whether it's like new treatments or like figuring out a diagnosis.
Yeah, for sure, for sure. And so where can everybody find you on Instagram is primarily where you are, eh? Yeah. And so where can people
Yeah,
find you?
at Spoonful of Lindsay.
Wonderful. Yeah. And then my very last question for you today is it does not have to be chronic health related. I'm wondering if you have any if you're into any like movies, TV shows, or books right now.
Oh, I am into like a lot of books. Like right now, I mean, ask an English teacher what their favorite book is, and that's like a really long question. But I would say right now, I'm really into like anything that's written by Alice Oseman, who wrote the Heartstopper like graphic novel series. And she also like recently had the Heartstopper series like turned into a series on Netflix.
Oh,
Um, And I really loved the graphic novels. And I ended up deciding she has like a whole bunch of novels and like this whole universe that she's created. So I've recently started reading in order, like every book in her like universe, which has been really cool. And I tend to, I would say most of the time rely on like my tried and true TV shows that I go back to, like if I don't have a lot of energy or I'm feeling sad, like my comfort shows. And my like big ones lately have been like we rewatched Friends, but I also really enjoyed Ted Lasso and Shrinking, which were really, really good.
Ted Lasso was so funny. That was a good show for
Mhm.
sure. I haven't seen
Super good.
Shrinking.
Yeah.
I haven't seen Shrinking, so I can't comment on that, but I've heard really great things about that. But Ted Lasso was hilarious. I was
It
I
was
I binged it quite quickly and I literally was in bed laughing my head off at like way too late than I should have been. But yeah, it was quite good for anyone who hasn't seen it. Wonderful. Well, thank you so much for joining me. I do appreciate you taking the time.
Yeah, no problem. Thank you for having me.